So let me know when the recording is up and running since
we are ready to go.
Ready to go? Okay. So welcome and thank you all for joining us this morning. As Joyce said, my name is Sarah Levin-Lederer and I'm an Education and Outreach Coordinator for the network of the National Library of Medicine Region 7. The building in the picture is the UMass Chan Medical School campus, which is where our physical offices are located, but we cover New England and New York. My background is actually in public health, but I work with several folks whose backgrounds are in library science. And so in that way, we are able to cover a wide array of audiences. So today I'm just going to do a quick overview of who we are and the resources and services that are available to you from us for free because you are with us here in Region 7. So the network of the National Library of Medicine is the outreach arm of the National Library of Medicine, which is the world's largest biomedical library and is physically located on the NIH campus in Bethesda, Maryland. But the library itself maintains many, I'm not sure off the top of my head what the current count is, but quite a few online databases of health information and resources, ranging from the highly specialized to resources for the general public like Medline Plus. PubMed is the other big database that many of our partners may be familiar with. The network itself is 7 regions and 4 offices that cover things like evaluation, training, and we have a public health office as well. And then the regional medical libraries themselves, our region, coordinate the activities of NNLM and are designed to be regionally responsive. So what we need here in Region 7 may be different from what our colleagues in Region 1, that is the Mid-Atlantic and South, may need. So the network of the National Library of Medicine, NNLM, the mission is to provide U.S. researchers, health professionals, public health, workforce, educators, and the public with equal access to biomedical and health information, resources, and data. And so the idea is to be able to train on the resources from the National Library of Medicine, provide support. We're going to talk about some grant funding. We also do a lot of work to better understand what our region needs and to support a wide array of partners from the public health workforce, which is usually my main focus, as well as our library partners, and understanding the different needs of folks working in public libraries with the general public, folks working in academic libraries, folks working in health science libraries, as well as community-based partners, faith-based partners, healthcare professionals, and really working to make sure that folks feel supported when they talk about health needs or health resources or health information, and that they know that they have access to things like Medline Plus and PubMed. So in Region 7, like I said, we are located physically at the UMass Chan Medical School in Worcester. We have 4 outreach and education coordinators, and we do a variety of things, including teaching and training. We have some funding. We have a special project called Focused Outreach, which I will talk about more as we go on. And then we also have a list of special initiatives, things that we are particularly interested in our region and offer additional support on and can help connect folks with other partners or subject matter experts if they are interested in learning more or engaging more with those initiatives. So this is our team. And so the 4 education outreach coordinators, we do a lot of the same things, supporting our funded partners, doing some teaching and training, but we all have slightly different focuses. So like I said, I do public health. I also do graphic medicine, which I will talk a little bit about later. I am also interested in health and climate change. My colleague Margot Malachowski, her focus is hospital librarians as well as rural health. Uh, my colleague Sean Corning, their primary focus is academic libraries as well as data science. And then Benny Finch is working a lot on connecting with public libraries as well as multilingual and multicultural health and resources for those communities. So one of the big things that we do is teaching and training. The this graphic is a little bit small, but it really illustrates that we are doing different kinds of classes and participating or teaching different classes across the year. And we are just one small part of a larger training schedule that is maintained by our National Training Office. So our colleagues in other regions are teaching other classes that are open to everybody in any region. And we teach things like providing multilingual, multicultural health information, an evidence-based public health course. Benny works a lot with the site NLM Wikipedia Editathon. We also, as well as contributing to the national training classes, we also make sure that we are doing webinars that include regional specific, either promoting work that is being done by partners by providing them a platform to share the exciting things that they're doing, as well as when we hear from partners about specific needs in the region, finding presenters that can really speak to those issues as well. And so ongoing trainings, slates of trainings, they're also presented in different ways to make them easy to fit into your schedule. 1-hour live webinars, as well as longer Moodle classes, as well as on-demand classes. All the classes are free. They are also often have CEs attached. So CHIS, Consumer Health Information Specialization, as well as MLA credit. For our public health partners, we offer CHES, which is it is also a health education specialization and certified public health CEs. And again, classes are free, CEs are free as well. So some of the specializations, we actually, unfortunately, are sunsetting the disaster information, but the data science specialization is being stood up more. The CHIS classes, again, specialization with a partnership from MLA, and there is some money within the region to help support folks getting their CHIS specialization. We also have the opportunity to do regional trainings. So like this, coming out to you, virtually coming out to you to present on topics that may be of interest to your community, to your organization. We work a lot on the somewhat on a train the trainer model, in that we provide the information to professionals who then provide it to the folks that they serve. So the general public, students and staff at K-12 or academic settings. But there is the possibility to do trainings on things like Medline Plus to make sure that your staff feels comfortable in working with those resources, or with PubMed if that's something that you need. And then also bringing the resources of Region 7 to a larger audience through a regional speaker series, or including them in other series, bringing them in as panel participants or other subject matter experts in presentations that could be part of that larger national training slate. We also do have some funding. Unfortunately, our funding call for proposals for next year is already closed, and we are currently reviewing those. But that actually makes it a good time to sort of start thinking about what you might do in 2024. Right? Yeah, next 2023, 2024, 2025. And so we do offer some support for grant writing as well as the grants themselves. So we offer two main and then some smaller grants. Our Health Information Outreach Award is generally up to 20,000, and so this is for any program that is doing some kind of health programming. So it's bringing a program to your staff, to your community, to the folks that you work with. These are generally considered pilot programs, so things that you maybe have been thinking about integrating into your work, but haven't had the money to make that happen. And so trying it out for 1 year and hopefully carrying it into the future as well. Our technology grants are our other big funding stream, usually up to 10,000. And those technology grants go to buy things like actual physical equipment, computers, tablets, projectors, anything you might need in a technology sense, as well as software. We've had folks apply for technology grants to update their websites as well, because most of our resources live online. And so the technology grants are designed to try to address some issues with the digital divide. We have in the past also offered a data management grant, and also have offered a collection equity grant to bolster library collections, especially around issues of health equity. These grants run for a year. Our funded year is different than most other places. We run May to April. So our 2023-2024 grants will start May 1st, which is the beginning of our funded year. And those grants have a year to run. So again, it's in the grand scheme of things, not a lot of money, short amount of time, but definitely a way to continue to connect with our partners and help support you as well. So focused outreach is a special project that we run in Region 7 that is different from any other regions. The idea of focused outreach is for us to methodically learn about your regions and the needs within specific geographic areas of our region. So bringing our resources to communities to learn about the health needs, and then also the health information seeking behaviors. So learning what you need better to better serve you and your organization. It's also a way to strengthen existing partnerships. We use it as a chance to reconnect with the organizations that we are with, our partners who already are in the regions that we're looking at, and then also to create new partnerships. And also a chance to conduct trainings for partners. So this actually, when I talk about our geographic regions, you will see that this presentation is actually an outreach of our focused outreach for this year. So the model for focused outreach is a semi-structured interview with community partners. And so we identify key organizations serving the community. And again, these are all of the different kinds of organizations that we work with. So we're looking at talking to academic libraries, public libraries, hospital and health science libraries, as well as non-library partners, community-based organizations, public health, and to get their take on what the information needs are of the people they serve are and what the health-seeking behaviors are. And when we conduct the interviews, we are learning more about the needs. And then during those interviews, it also gives us a chance to either reintroduce or update existing partners, or completely introduce who we are and what we have to offer to new partners. So this year, our 2022-2023 focused outreach areas are the 4 northern counties in Vermont and Berkshire County. So my colleague Benny Finch and I have talked to quite a few partners conducting the semi-structured interviews, and then also used it as an opportunity to say, hey, if you have a group who would be interested in learning more, we're happy to come out and do that. And so that's actually where we started with this presentation, saying, we want to make sure that we are connecting and introducing ourselves to as many people as possible while we have this concentrated focus on your area. If you are in those 4 northern counties and are interested in going through the semi-structured interview process to tell us about the needs of your communities, we would still love to conduct a few more interviews. So, feel free to send me an email on that. This contract for our office, which is a 5-year contract, we are focused completely on rural health as well, because we are interested in making sure that we know and understand our rural communities. So then our special initiatives. And I am talking way fast, so if there are any questions, please let me know. We have quite a few special initiatives. So along with our focus areas where I mentioned that I work a lot with our public health partners, Benny works with our public library partners, Sean with our academic partners, and Margot with our hospital librarians. We also, all of us have areas of specific interest and areas where we are looking to engage in training, connect with partners, share resources, and help partners connect with each other who are interested in these areas. And so rural health is something that we all are working on, especially because of the focus, the focused outreach focus on our rural areas and the needs of those rural areas. And so Margot in the past has taught a rural health class. That class will continue, although I will be teaching it in our next year. And so it's something that we are particularly looking to work in. We are particularly looking to fund partners in those areas. We are particularly interested in learning more. We are particularly interested in helping folks network in rural areas. Substance use disorder, this is one of Sean's special initiatives. They are helping to put together toolkits. They are helping to bring a speaker series together, and also helping to produce more information for partners around substance use disorder. I'm going to skip graphic medicine because that's mine, so I want to talk more about that. Again, Sean is working with academic libraries, and we have put that in our proposal as an area where we really want to grow and we want to learn more. Health information outreach in languages other than English. There is a class that we teach nationally on that, but we also are looking to bring that information to our partners within the region more and figuring out how we can support that information sharing to support folks who are working with communities, multilingual, multicultural communities, and the communities themselves. Public health, we are looking to grow into the public health sphere more, especially with public health students. And again, this is one of my special initiative areas. And then hospital libraries is one of Margot's, especially looking at the fact that hospital libraries are changing a lot right now. And unfortunately, a lot of them are closing. So how do we support the librarians as well as the libraries that continue to exist in that area? So as I said, graphic medicine, besides the public health sphere, graphic medicine is one of my focus areas, and we do a couple of things in this area. Graphic medicine is comic books and graphic novels that have a health, wellness, disease, narrative, focus, theme as a way to talk about and in some ways destigmatize, educate around that health topic. And so a lot of these are graphic memoirs, so people's personal stories, but then they also include narrative nonfiction, some fiction as well, but anything, again, that's sort of in that sequential art realm, comics, uh, pictures and words telling a story. One of the things that we have is graphic medicine book club kits, which is a program in a box. It's books, discussion guide, supporting health information, loaned for free. We include the return shipping label in the kit to our Region 7 partners. So if you are looking to have a book discussion group and would like to try something new, these are available to you. And we've had them used in public libraries, in academic settings, with community-based organizations, clinical settings. And we've also had some good partners who have used it as a good networking opportunity. So academic libraries partnering with public libraries, public health partnering with public libraries. We have 12 different topics in the kits, ranging from familial substance abuse or substance use, grief, cancer, mental health, veterans health, aging and caregiving, emergency preparedness, uh, epilepsy, and it's not written in front of me, so I'm not going to be able to do all of them. But HIV, AIDS. So anyway, 8-week loan period, program in a box, completely free to our Region 7 partners. One of the other things that we do in the graphic medicine, and actually for several of our special initiatives, are communities of interest. So partners in the region who are interested in a topic, giving them a chance to come together and work on some projects, network within the region, and just generally be able to support each other in their work in these areas. So we do have a graphic medicine community of interest. They have helped put together webinars. They have helped to put together a virtual social. They have helped each other, supported each other in putting together training opportunities and sharing resources that they themselves have developed. So if you are interested in graphic medicine or if you happen to already be working in graphic medicine and are interested in joining, please let me know. We have a couple of ways to stay up to date with what's going on in our region. The best way is usually the newsletter. It's weekly, right to your inbox. You get our blog posts, our class announcements, funding announcements, other networking opportunities, and there are also often job postings on those. We also have social media. Right now we are active on Twitter, a little less active, but still have a presence on Facebook. And then we also have an office email. So I will be sharing my slides. So you'll have all these links. My email is on the first slide. But if there's a question that you just sort of want to put out to the entire office, that is our office email. And I think we have about 5 minutes for questions. So I'm going to stop sharing my slides so I can see what's going on.
Thank you, Sarah. That was great. I have a question just to clarify. Partners, are they just anybody in the region, or is that somebody that in the region that you've connected with already?
So we are technically a membership organization. Membership is free. You have to be a member to apply for funding, but and then the other thing that membership gets you is being listed on our membership roles, which are public, and so that provides a potential networking opportunity. We, however, will do presentations like this. We will, support uh, anybody in the region. You do not have to be a member to request a training or done with the health outreach grant. Um, so the question in the chat is about examples of what folks have done with the health outreach grant. Um, the grants themselves are written very broadly, specifically to allow um, folks who are applying to sort of put their own spin on it. But it runs from everything from public libraries that have applied to do health programming, so including things like paying for Tai Chi or yoga instructors to come in. We've had folks do computer classes, so classes that are more focused on computer literacy, with the health focus being addressing health myths and disinformation, and how do you sort of sort through that in when you're online. Um, there's some of the other those are sort of the big ones. I mean, if you think about not computer, if you think about health programming in a library setting, um, we've had folks apply for grants that sort of run the gamut. Buying supplies, we've had people buy Charlie carts, which are for mobile nutrition lessons, where you can actually do like cooking lessons on them. Right. Those are
So
sort
I
of,
still have a
yeah.
question. I'm
Yeah.
still a little confused about, okay, so the partner thing, for example, if someone wants to do the graphic medicine book club,
Oh, yeah.
can they just, do they become a member? And then or they don't need to become a member.
No.
They just
Um,
contact you and say
yeah. The only
they're interested.
thing where you have to be a member um, is to apply for funding.
Okay.
Everything else that I mentioned, your and I should say your organization
Okay,
doesn't
that was
have
my
to be
other
a member.
question.
Yeah.
So do
So
people, would
membership is
individuals or the organization?
at the organization level. Um, you if you want to take a training, you do have to register to get the login, and so you have to have an account on our website. But that account again is free. You just create one, and having an individual account to, for example, take a class does not make your organization a member. Um,
Thanks. Are there any other questions?
I will also, since I sort of stumbled through the answer on examples of what people have applied for with the health outreach, those are public on our website. And when I send Joy my slides, I will also send the link to examples of past funded projects.
Great, that would be helpful. I am putting a link to an evaluation for this in the chat, so if you all could fill that out, it's short, but it's helpful for us in planning future CE workshops. So, all right, thank you again,
Yeah.
Sarah, and thank
So
you
I
everyone
want
for
to,
coming. Yeah,
before
go ahead.
the recording, there was a comment in the chat that the Heinsberg and Charlotte libraries did programming around mental health and wellness and had a a number of speakers, including an author, a yoga class, and then they also bought books for their collection. And so that is, people or organizations have bought physical things that they can add books or other resources. They've also brought in speakers. They've also, if an organization is putting up a program that requires staff time, they have included staff time in the proposal. So it's very broad by design because you know what your organization needs and would use.
Yeah, and I just going to add that I've applied for one through the Department of Libraries, and just that the support from NNLM was really strong, like just in terms of helping me write the grant proposal and giving feedback on the drafts of it. So it's a good grant to apply for, even if you don't have a lot of experience in stuff grant writing.
So the other thing I did mention that for next year, our grants are already closed. But if you have an idea that you want to talk through and start thinking about now, we're here for that as well. Like we are happy to chat and bounce ideas around, or when the time comes, read drafts, give feedback, things like that.
Great. All right, and I will be putting this recording up on Niche Academy and the slides as well, so you can get those links and tell other people about it too, so that other people can watch it. Thanks again, Sarah.
Thank you.